Hello everyone, welcome to yet another episode of Motherhood Unscripted. I am your host Gladys Kang. As we all know, motherhood is unscripted and there are so many things that before we become mothers, we do not have the information. The reason why I started this podcast is because personally I used to look for such information and I couldn't find them anywhere. And once I got to learn, I knew immediately that there are so many moms who are out there who are looking for information but do not know where to find it. Guys, I have a very special guest who is with us today or with me today, and I'm really excited because I know by the end of this session we are going to learn so much. So without wasting any time, I'm going to let her introduce herself, tell us who she is and what she does. Karibu sana, you can introduce yourself.
Okay, thank you, Gladys. I'm very glad to be here. Hi, everyone. Today I'm also participating. I'm learning from Motherhood Unscripted. My name is Pamela Kadure. I'm a nurse who has passion in midwifery. So we shall be talking more of midwifery compared to Motherhood Unscripted. And we are very hopeful that you will learn. If you have questions, you will ask under comment section and we shall be glad to answer them in the next episode. Welcome.
Thank you, Pamela, for the wonderful introduction. And thank you for even making time. What inspired you to become a midwife? Maybe we can start from there, then we continue.
Yes, I'll answer that one. So for me, I'm a general nurse. I can practice in any ward, but now since I did nursing as a mom, I'm very passionate with midwifery. That's why I find myself helping moms. That is my lane. Now that I became a mom, before the profession part of it. So I like moms. That's why I like giving them knowledge. Yes.
Oh wow. I'm sure you have so much experience. I believe, again, the way you have said, and I've taken note, you practice after becoming a mother. And that is why you are so passionate around motherhood. I think I can relate with that because even me personally, what I'm doing right now was inspired after I became a mother. So we have a thing in common. So thank you for that. And maybe you can explain to us, for those who don't know, is there a difference between the two, being a nurse, being a midwife? Is there a correlation? So maybe you can explain for someone who is at home who can say can differentiate a midwife.
Nursing, it's general. But now midwife deals with pregnancy, child delivery, and also now the postpartum, the mother and the baby. You take care of the mother and the baby.
Okay.
Yes.
That's wonderful. At least some now can be able to differentiate. Even me personally, I never used to differentiate the two, but now at least I have the information. So now, with your profession that you have practiced, how long have you practiced as a midwife? Yes, you can maybe share with us a bit, just a bit.
Yes. I've been a midwife for more than 5 years, practicing in a busy facility, that is in public hospitals. So I think I've come across most cases, or like I have experience when it comes to midwifery.
Okay.
Yes.
That's good. 5 years is quite a lot. And I can imagine if you can start sharing from the first day up to now, you can write 10 books. So it's an honor to even have you here to share your wisdom. So maybe we can start from someone like me, because as women, we usually once a woman is pregnant, we don't usually have so much information around what to do during pregnancy. So, for example, I am a mother and I have realized that I'm expecting. So there are some of these things that are very, very important for us to know. Some of us maybe know, some of us don't. Maybe you can share what to do immediately a woman knows they are pregnant or they're expecting. What is the first steps? What are the first necessary steps from a midwife's experience that they should take? Yeah, maybe you can share a bit.
Yes, Gladys. I think the best way to tackle that question, we shall be dealing with all ladies or women of reproductive age.
Yes.
Because if you are a mother, maybe probably you've delivered, you know one or two things. Yes. But now we have this, even our little girls, they are nowadays, we are getting them in maternity. Yes. They know nothing, they are green when it comes to reproductive health. So I think we can address them, or even those who are there maybe went through harsh motherhood. So first thing, immediately you realize that you are pregnant, despite the weeks, despite we don't have timelines. Like we say, immediately you realize, you notice you are pregnant, make sure you attend a clinic, antenatal clinic, because in these clinics, this is where now you get to know many things, like or else a lot will be done. There is that thing we call ANC profile. We'll do some tests. You'll get to know your blood group. You'll get to know your HIV status. That is very key when it comes to pregnancy. You are able now to protect your baby. We will give you tetanus injection. So if you are, let's say your blood group is, you are a rhesus negative mother, you are given anti-D. Nowadays we are doing it twice. During our time, we were doing it once after delivery within 72 hours. Nowadays, you get that injection at 28 weeks. So you see it is an advantage going to clinically. Then also, you will be advised on what to do, like planning for your baby. You are able now to plan for your baby, despite the fact that there are these pregnancy, you call them unwanted. You didn't want this baby, but now that the baby is there, the pregnancy is there, you have to plan for your baby. Key, we say this is key point to note. Whether you are at school, plan for your baby. Think of a friend you can disclose to your friend, because delivery, it's not just a mere thing that you take lightly. Sometimes it's a matter of life and death. So it's good to prepare early. Know who will accompany you when you're going for delivery. You need to also have some cash. Nowadays, you're in Kenya, the economy. So get to save for your baby. Do shopping. You prepare that. We always say have 2 bags ready for that day, your delivery day, your EDD. So these bags, you need to put some items for you and for your baby. You need baby's clothes, you need diapers. There are those general basic things that you must require. Whether now you are a teen, whether you are a mother of 5, you must need diapers. You must need pads for your use. You need a dress there, because sometimes our machine can crack down and we don't have linen. So when you just stay there naked without clothes, just because you didn't prepare your bag area in advance. So have your bag ready. Have your baby's bag ready. There are those items. Next time we can also talk about those items that you require to pack them before that day, because you don't know when your labor pain will start. You can be at work, so you just call someone, tell them pick the 2 bags, bring them ready for you. Another thing, eat balanced diet during pregnancy. You require nutrients, your baby also require nutrients. For example, during delivery, you lose a lot of blood. So if you are not consuming iron-rich food, you will lose a lot. You will be in problem, like you need to be transfused. And these are the things that you could take care of them during pregnancy. That is eating right food, not eating mawe. Unajua sasa wanawake wanatafuna mawe.
Yes.
They don't add anything. It's just an eye opener, like your body requires iron. Sasa. So kitu ingine, Gladys, and a very important one. You need to choose your companion, birth companion. We call them birth companion. They are very important. In case of emergency, they can chip in very fast. Maybe there is something we require from our side, from the facility. This is a person who will take you to the facility, who knows like the facility you've chosen. You also need to choose the hospital of choice. You can do two in case, because unajua delivery it's not anticipated. Yes. Unaweza kuwa uko na mtoto wa kwanza. Yes. You underwent that normal delivery, but for the second one you go for CS, and maybe the facility that you delivered last time, they do not have an operating theater. Unaona, you'll be forced now to go to another hospital. So all those things should be in your mind, like in case of anything, naezaenda facility gani. So when you choose the hospital on time, it will also save you a lot. Like you have an insurance you want to use. Maybe hospitali yenye umechoose awatumii. Unaona sasa, now that your due date is not yet, you have time. Unaweza tafuta another hospital, una make those arrangements, unajua wanahitaji nini. Juu siku ya uchungu ikikuja, you don't have time, you don't have luxury ya kuchoose like take me to this facility, take me to this hospital. So those are the things you need to do immediately. You realize that you are pregnant. Yes. Exercise. Also, immediately you realize you are pregnant. Don't now bed rest. Unajua, most of our ladies now, they take it like now this is an opportunity to rest. Yes. As married women, this is an opportunity now for my man to do those kitchen jobs. You want to use them as much as, yes, they can help. But please make sure unafanya, because it helps your body. Like, don't just rest, don't just sleep. Ukilala ndio ukikuja maternity, now when it comes to pushing, unatuambia you don't have energy. Now what are we supposed to do? You must push. You are the one to push your baby out. So do some exercises during these 9 months. Yes. Wow.
Those are very powerful points there, Pamela. And I'm sure that one who is at home, that mom or mom-to-be who is listening has taken a few notes. Now, there are some few misconceptions, maybe I can say, about being a midwife. Maybe some people, when a mom at home, you're scared to go to the hospital. There are mothers who are scared to go to the hospital. They have a notion about a midwife. They are scared. Maybe, I don't know if you have had some misconceptions about midwife. Are they true? Are they not? Because some of women, when we are talking at home, they say, the hospital is not good. Some are even discouraged not to go to the hospital because they say this and that. Maybe you can share a few misconceptions about midwife and whether or not you have heard whether some of them are true or false. Maybe you can share a bit.
Sure. Yes. I know they talk a lot about midwives, but what I can tell them for free, a midwife should be your friend, especially during pregnancy and during delivery, because delivering at home is very risky. We discourage at all costs. Midwives, if that's why now we are saying there are things that you are supposed to do.
Yes.
If you do all these things, if you attend our ANC clinics, if you follow what you are advised, you'll be free to come. Because for one, we know those with those misconceptions, for one, they don't attend clinics. And they know the first thing when they come to our side, we will ask about booklet, the ANC booklet, because it has a lot. We get to know more about, you are in labor, you are not able to explain some of the questions that we will be asking. But with this ANC booklet, we are able now to tell this was done, this was not done. For example, your HB is low, so we need to prepare blood in case you need blood. So we believe that if you went for ANC clinic, if you attended ANC clinic and not less than 6 times, you'll be very free to interact with midwives. You are confident, your labor goes on well, because we advise even hygiene is another thing that most women, they don't want to face us, because you took pregnancy like a disease, like you don't want to do anything, you don't even want to shower. Surely ndio maana hamtaki midwives. But for sure I'll tell you, ukikuwa you attended clinic, umefuatilia everything, you are very confident. You are even willing to have even a private midwife because you are confident. Uko msafi, like those are the things that give you confidence. Lakini kama hujaienda clinic, you even don't know your blood group. You are maybe a previous mom, so this is your third surgery. Unaona, that one is a high risk pregnancy. You've not gone to any clinic. So unaona, and you want this midwife now to start laughing or to, no, they are doing their work. And we must protect you. It is our responsibility to protect you as a mom. That's why I think, to my understanding, hatuko wabaya. Ni wao wanakuanga wanyafanya vile tumewaambia. So wanajaribu kuonyesha like we are, but we are not. Alafu when it comes to normal delivery, our aim or our objective, our main objective is at the end of the delivery, we want to have a stable mom and a stable baby. We want to have both of you stable. So that's why we don't laugh most of the time during delivery. In that room called labor ward, we want everyone to come out. Like we want a successful delivery. Tukicheka hapo, ufinye mtoto wako, you will blame me as a midwife. Unaona, that's why midwife, they are very tough sometimes. Because we know, tukikuonyesha sasa, it's just a normal thing, like you take it lightly. To compromise the end results, and we are interested in the end results. So we must be tough, but after that, you laugh with us. We've experienced this, we know how it goes. You are very grateful, you are very happy seeing your baby breastfeed, going home with your bundle of joy. That's our happiness.
Oh wow. Thank you for sharing, because I know some at home, you have now removed that fear, because so many women, they're like, hey, no, I don't want to go there, you know, those people are not good. So thank you for sharing that. Now, for that mom who is there, who is pregnant, maybe there are some danger signs that maybe they could have avoided during pregnancy. You know, some of us, maybe we are like, maybe I'm feeling some sort of maybe pain, something I'm ignoring. So what are the danger signs, and when is it very, very necessary for me to go to the hospital immediately when I see these signs as a pregnant woman or girl?
We have several danger signs during pregnancy. We shall be discussing some of them. And we say immediately you see any of them, go to the nearest facility. Not necessarily like where you are attending your clinic. It could be at night and you are bleeding, you see. So go to the nearest facility and you will be helped. Let's discuss some of them. One, vaginal bleeding. If you say you see any blood, please, whether it doesn't matter whether small, like it's soaking a pad or not, but you need to go to the hospital immediately. Another thing, reduced fetal movement. If your baby stops kicking, you are the one carrying the pregnancy.
Yes.
So when your baby is active.
Yes.
So you are the one to note, like, today have not had my baby kick.
Yes.
I've not had my baby like several times the way they do it. So immediately you realize that your baby is not active the way they used to be. Go to the hospital, they will do a scan. There are many things that can be done to see what's happening.
Yes.
If there is breakage of water, like we call it like, if you realize that this is not urine, please do not assume, or like you stay at home thinking, I'm not able to control now my urine. It's just, no, come to our facility. We will be able to differentiate whether it's urine or it's the like fever. You may be having some fever. It's a sign of infection. So it's also advisable, like, you go to the facility, they will do their tests, and you get help immediately to save the baby. Conversion. In case you experience whether one episode, it doesn't matter. Hata kama ni hiyo episode moja tu uliconverse, go to the nearest facility na utasaidika. Yes.
Okay. Now we have known the danger signs of to watch out for. So you who is at home, please, if you experience this, or if you know someone, it could not be you, it could be your sister, it could be your neighbor, your relative, your mom, whoever who is near you, maybe it's very good to have this information and know immediately when to go to the hospital. So thank you for sharing. So Nurse Pamela, being a midwife for over 5 years and having worked very, very closely with mothers at the hospital and helping them deliver, how has your work changed your perspective on motherhood? Maybe you can share a bit. Yeah.
Sure. I like that question. My work experience as a midwife or in reproductive health has helped me understand mothers a lot. Kitambo, we used to think like, they are exaggerating, they are doing it too much. But now, since I started practicing as a midwife, I can understand the pain. I'm also a mother. It has also helped me. So anytime I see a pregnant woman, hata kama ni kwa barabara, I feel like this is my client. I see them like my client. I see them like they keep me doing what I like doing most. I love them. I love babies. Like, I enjoy maternity. I enjoy delivering. I enjoy taking care of, working in labor ward. Sometimes wanaweza shangaa tunaenjoy nini, but we enjoy delivering. Kuoshwa tu, unaogelea huko tu na damu, but it's a nice thing hearing that baby make that first cry. That is what makes us midwives happy than never. We are very happy to hear that we deliver anxiously, waiting for that cry. So immediately you deliver a baby and the baby cries, you feel like you've achieved. We achieve. So I think it has helped me love them the more. Yes. And I take them positively. We walk with them the journey. We encourage them and we get better results.
That's wonderful. Hey, I feel so relieved and good because, sometimes as me, I cannot be able to see that outside. When you go to the hospital, you are scared. But hearing that firsthand from you, it gives me a lot of confidence. Even going to the hospital, you'll be taken care of. So that is a very, very powerful point. And my last question. What advice would you wish every mother would hear before giving birth?
So what I can advise them, be positive. If you come with a positive mind, everything will proceed very well. You will progress to second stage, you will deliver, you will have also a positive postpartum, and you will all be healthy. Yes.
Wow. Thank you. Thank you so much for your time, for your wisdom and expertise. I'm sure those who are listening have learned a thing or two when it comes to what it entails being a midwife and why it is so important for pregnant women to take care of themselves. So we have come to the end of this episode. Thank you so much for tuning in, for listening. Please like, share, and subscribe. Thank you so much again for tuning in, and see you on the next episode. Bye bye.